Nobody talks to them. They don't get any opportunity.
Although the first HIV-positive victim was found in USA in 1969, AIDS has claimed more lives in Africa than any other continent, the hardest hit areas being Sub-Sahara Africa. Phile Bongole Lutaya held the HIV/AIDS by the horns and spread awareness through his music. However, the disciplines who are walking in his footsteps have guaranteed to launch a campaign of infra-criminal charges against health workers who have failed to follow up HIV patients who are on antiretroviral treatment. Millie Katana, an HIV activist, says they are to drag the service providers into courts of law that have lost HIV/AIDS patients as a result of poor supervision.
In this generation, where each one of us has these sophisticated communication weapons, which we never used to have the time Phile Lutaya gave a face to HIV, it's criminal that health providers lose patients to follow up. I'm starting this and stand to be warned, we are going to infer criminal charges on health providers, including mild men.
She also cautioned health service providers to improve on the quality of care given to people living with HIV/AIDS. A retired UPDF officer, Major Rubaramira Ruranga, wants the public to disclose their status because hiding it is a fertile ground for it to spread.
But they are the people who will be representing us, and they are, if you ever say they have HIV, they may run away from that life. So these are the people who went and changed the whole process, and the process has failed to work as a result.
Martha Nakato, a young positive ambassador, is concerned about stigmatization and discrimination of young people living with HIV in learning institutions and schools.
Take note, if a kid asks you for a pass out to go out for a medical issue, please take note for love. To the teachers, we all make comments in class, but take note, there are students in the class who are teaching who are really living a positive life.
Phile Bongole Lutaya's Day is celebrated annually by the founders of National Forum of People Living with HIV/AIDS Network in Uganda, and their statistics show that out of 1.3 million people living with HIV/AIDS in Uganda, about 700,000 are on ARVs. Ivan Kaahwa, Joseph Oko, UBC News.